people in trades, man, they making 100,000, 200,000, $300,000 a year from a trade.
Mhm.
See what I'm saying? And then I'm gonna have it set
Yep.
up like I said. They're not gonna be acquiring debt.
Yeah.
You know what I mean? The state's gonna cover their training.
Yeah.
So it's just gonna just. I believe this in itself will start fixing the state because it's hard for the state to even get a grip on crime.
Yeah.
And I saw reports that came out. They say, "Oh, crime was down. Crime was down." I knew it wasn't down
Yeah.
because the education system is broken.
Yeah. And we live in it.
We live in it.
Yeah, we
Correct.
know. We see
Right.
it
We
firsthand. And
see it
that's
firsthand.
why, like, you got to be able to solve a problem. You got to be able to diagnose the problem. Like, a lot of times with pundits, and this is what makes you different.
Right.
Your boots on the ground.
Fact. Fact.
This is a live experience, not you just looking at your phone as some stuff that the algorithm threw your way,
Right.
or just some numbers.
Right.
Saying the statistics say this, because it's nuance and caveats to numbers.
Right.
And with your boots on the ground, you can look at it and see the problem. And see, the thing is, this is how you know when you're dead on. When somebody's looking at the same thing and y'all come to the same conclusion on how to fix it.
Right.
That's how I know you're on the right track. So you talk about also mental health and addiction.
Mm-hmm.
During COVID, when we couldn't go to the gym and we was working out here.
Yeah. We was getting it in, man. I was thinking about that the other day too, man. I still got the pictures from that.
Me too.
Yeah,
absolutely.
Yeah.
This is going to get a little touchy.
Okay.
I lost a kid that I raised.
Wow, brother.
Thank you to it was fentanyl in the pill that he popped.
Wow.
And during that time, this when everybody was afraid.
Right.
He was a young man.
Right.
And they wouldn't even let us come to the hospital.
Wow.
And he laid there and died by himself.
Mm. Wow.
And mental health, addiction.
Mm-hmm.
I grew up with an addicted parent.
Right.
So when I and around that is mental health, because you don't know. Our parents was the ones who the uncle climbed through the window and touched them, or
right.
Dad left and went and got milk and didn't come back.
Right.
That old school crazy stuff, right?
Right.
And we was the children when crack was new. And let me try this. Then somebody didn't know that they had an addictive personality and you didn't see them no more.
Right.
And then they got into other stuff. And boom, the 80s and 90s.
Yeah.
So like these are subjects that's close to me. And then I still see it. Right. I'm blessed that I was able to make it out.
Right.
You know what I mean? And one thing about our views and our standpoints, we understand starting points. And we understand that we got to work to get to this point, and then our kids' starting point to be here and so forth. And that's the way it works.
Exactly.
It's not I stay here and I keep looking backwards and I never move forward.
Right.
You understand what I'm saying? So when what is your mental health plans? What is your vision for mental health and how to solve the substance abuse and addiction?
Yeah, I'm going to put a plethora of resources together to attack that.
Mm-hmm.
You know what I mean, so I've been just sitting up thinking of just every way to combat the issues that's going on in Maryland. And so while I'm fixing education, I said, man, I also gotta fix people that's dealing with addiction, homelessness, mental health. I have to attack that as well. So I'm going to be working with all the community leaders, just be getting feedback from the community, people like yourself, brother.
Yeah.
Just talking to people, just trying to figure out what resources do we need to put together that's going to help these people heal.
Yeah.
And because like I said, as we attack in education and public safety and all the other stuff, we also got to be attacking the mental health, substance abuse, and homelessness that's going on in the state of Maryland.
And that's part of the triangle that we talked about earlier: the community, school, and family.
Mm-hmm.
And that lies in there because it affects the people around them. One thing though about addiction is that it's a disease